Hi, welcome to What's Happening at Tri-City Medical Center. I'm John Bonosoro, and I'll be your host for this new series made in collaboration with KOCT, North County's channel, and Tri-City Medical Center. Our goal is to keep you informed about health issues, events, and services at your local hospital and to provide you with information for a healthy lifestyle. June is Men's Health Month, and we have the perfect guest to discuss that topic. Dr. Jason Phillips is a board-certified urologist specializing in men's and women's urologic health. Dedicated to providing patients superior care, he has a special interest in treating BPH, urologic cancers, kidney stones, overactive bladder, incontinence, bladder prolapse, and erectile dysfunction. Dr. Phillips works at North Coast Urology in Oceanside, and he's a staff physician and surgeon at Tri-City Medical Center. Doctor, what does a urologist do? That was a pretty complete list that I went through. Fill that in a little bit for us.
Yeah, thank you, John. So a urologist is a surgical subspecialist that focuses on the urinary system in women and the genito and urinary system in men, comprising the kidneys, the ureters, the bladder, prostate, as well as the penis and the testicles.
We hear a lot when we talk about men's health about the importance for checkups as opposed to waiting for symptoms. Can you tell us why that's so important?
Absolutely. For men's health, as men get older, we think of the cardiovascular system, and we think of all the other systems such as musculoskeletal and arthritis. But if you're looking at men's health and for men's health awareness, the urologist plays a very important role because we are involved with testosterone, erectile dysfunction, prostate issues, whether that's prostatitis, BPH, which stands for benign prostatic hyperplasia, or in just colloquial terms, a big prostate, which the end result is difficulty with urination.
Some of these can happen at any time, but many of them are very age-related, correct?
Absolutely. If you look at men as they get older, probably 50% of men who are 50 years old have urinary difficulties. If you look at men kind of across the entire nation, there's at least 30 million men with erectile dysfunction, and low testosterone becomes much more prevalent as men get older. And men are much less likely to go to their doctor than women are because they don't have the obstetrician or kind of that lifelong care. So as men get older, it becomes much more important to go to the urologist and your primary care physician. For example, I'll see men that have erectile dysfunction, and that's a precursor for cardiovascular disease. And if we find that, we'll often refer them over to see a cardiologist and sometimes catch heart disease earlier.
We talked about early tests. What frequency do you recommend?
Absolutely. Specific to urology, the PSA level has been really controversial after the U.S. Preventive Task Force came in and said they don't recommend screening. Our organization says we do recommend screening. For most men, typically around the age 50 to 55, I recommend a PSA level. Unless they have a first-degree relative or a really strong family history of prostate cancer, then maybe around 45. And then that frequency should be every year to every 2 years. And a digital rectal exam should also be performed. And that's for prostate health, prostate cancer screening.
What do we know about the causes of BPH?
Sure. BPH, as I mentioned, is benign prostatic hyperplasia, growing prostate. And it's like a donut. And as the donut grows bigger on the outside, well, we'll notice it on the exam, but the inside of the donut, or the donut hole, can become tighter and tighter. And then as that becomes, I guess, more difficult to urinate, that'll put pressure on the bladder and cause such symptoms as urgency, frequency, and difficulty with urination. We haven't really tied a definitive kind of environmental factor to it. There is a genetic predisposition, and probably the #1 risk factor is just getting older.
Okay. Which is something we all want to have because the alternative's not too pleasant.
Absolutely.
So what are the treatments?
So for the treatments for BPH, always start with medications and lifestyle changes. If that's not enough, then we have different surgical treatments. And the surgical treatments, the least invasive that I do in the office is something called the Urolift, which will manually push open the prostate to open up the donut hole so men can urinate better, and then the pressure's off the bladder. And then for other men, other treatments are required, such as a transurethral resection of the prostate. That's under anesthesia, where a camera is placed inside, and some of the tissue is actually removed, so that donut hole is opened up. Think of like an orange, where you take the fruit out of the inside of the orange and you're left with the peel. Well, that cavity is much bigger, the resistance is much less. You can urinate with a stronger stream. I also do that with a laser, a green light laser, but also under anesthesia. And for some men who have very, very large prostates, I actually require an open surgery or a robotic simple prostatectomy. That's probably the most invasive, but every man needs a different treatment that's tailored towards them. And typically I always start with medications. Then if their prostate is amenable, a minimally invasive treatment such as the Urolift, and then proceed down the path. You don't burn any bridges with either the medications or the Urolift, and then once you get to either a TURP or a green light laser or a simple prostatectomy, those men need usually significant help.
You talked about lifestyle changes. Can you give us a couple?
Sure. Think of truck drivers. They don't drink a lot of water. They don't go pee very often. They're going to be holding their urine, and they're training their bladder to be dysfunctional. I recommend, a man as he gets older to try and urinate, consistently, about every 2 to 4 hours, and really try and empty. And as it becomes harder to urinate and harder to empty the bladder, I recommend about, a few deep breaths when you're going to the restroom, so you can really empty out the bladder. Don't hold it too long, otherwise you will get some dysfunction with the bladder.
And I want to stress, we're talking about the benign version of this.
Absolutely.
Up till this point.
Absolutely.
With your treatment options. Another major issue, I think you mentioned 30 million men in America, is erectile dysfunction. Certainly a major topic in the news, everything from medical journals to pop culture. So what do we know about the causes and treatments for that?
Sure, absolutely. Erectile dysfunction is very prevalent, and I'll tell you, many men are embarrassed of erectile dysfunction or have difficulty going to their doctor about it, but it's very common. You mentioned 30 million men, very, very common. So with erectile dysfunction, typically it's a narrowing of the arteries that go to the, not always, but typically narrowing of the arteries going to the penis. And that causes the blood, to mess and have an erection. So that's why it's a precursor for heart disease, because those arteries are even smaller. As for treatments, I typically will list about 5 that I can offer men. And I always start with medications. Think of the Viagras or the Cialises. Often that's all men will need. But if that's not enough, there can be a vacuum erection device. Think of negative suction to allow an erection, and usually a tight constriction ring is placed at the base of the penis. And then we get into little pills or injections, and you can put a pill in the actual urethra to cause an erection. And if that doesn't work, then, as tough as it sounds, you can inject a medication directly into the penis, and that often gives an erection. And if nothing works and the erection is still something that's desired, I can put a penile implant in. And these penile prostheses work every time. Men have a very high satisfaction rate with them. And I've actually been very impressed with the results and have gotten very good feedback about this.
Okay, lots of options, more than probably most men know about.
Absolutely.
And finally, we have about a minute left. What about the causes and treatment of low testosterone?
Sure. Low testosterone happens as men age. There may actually be a protective effect. You decrease the testosterone, you might, as men age, you may very well be protecting men against doing more activities, more, aggressive activities. However, people are living longer, people are more active, and so the low testosterone can manifest as weight gain, low libido, erectile dysfunction, depression, and that can play a significant role in a man's life. Treatments for that, well, the workup for that is to get lab tests and then to be able to see their doctor. And then treatments for testosterone is testosterone replacement therapy. And those can be gels or creams, or they can be shots. And I actually have little pellets that I can put into the muscle right in the gluteus, right in the fat there, that can last for about 6 months. And so men can have an increase in energy, weight gain, weight loss, muscle gain, as well as erections and libido.
Wow, that's a lot of information presented very effectively. Thank you.
Thank you.
And Dr. Phillips, remember, is an expert in this. If there's something you heard that resonates with you, you need to see your doctor.